Welcome, everybody, to another episode of the Strength and Knowledge Podcast. I am here today with Dr. Mike Reinhardt, and we'll be doing a follow-up on his presentation in the recent online performance rehab summit titled Beyond Load Management. But before we dive into that, I want to dive a little bit into Mike's background and really his path to the profession. So, Mike, welcome. And please share with our listeners a little bit about what brought you to PT.
Absolutely. And thank you for having me, Josh. So like a lot of individuals that got into physical therapy, I kind of followed the trajectory of, in high school, I kind of fell in love with strength sports. Like many other people, I was never the greatest athlete. I was never the fastest. I was never the strongest. But I always looked for something to kind of give me that additional edge. And for me, I believe it was kind of my freshman year of high school. I started to fall in love with the weight room. So for me, I had a couple friends and a couple mentors that kind of got me involved in strength training, in weightlifting and things like that kind of bred this interest in learning more about the human body, learning how we move, how we adapt, how we get better, how we get stronger. And from a young age, like I made all the mistakes in the book. I did some stupid programs. I did the same workouts every day. I did the same muscle groups every day. And I kind of learned through trial and error and having some really good guidance along the way of like, hey, here are the things that the human body is capable of, and here are some ways that we can kind of achieve them through strength conditioning and through movement. So that actually got me kind of on my way to my exercise science degree. So I went to University at Buffalo for my undergrad in exercise science, and about halfway through, I realized I was spending more time learning about anatomy and learning about movement and training. And I realized that a really good it was a perfect thoroughfare to kind of get me into physical therapy, because I realized I didn't just like the strength side. I liked understanding how we could influence movement from kind of a greater scale. So I got involved in PT at University of Buffalo. And then from there, it just kind of has morphed to where I am now, working for Rehab to Perform. So it's been this really cool kind of collaboration between the rehab side and the strength conditioning side. And I really just like finding ways to kind of blend those two things together and make them mesh in the best way possible.
And Mike, I think you do a great job of that. And I'll also give you a quick plug as the strongest pound for pound member of our team. So clearly strength and conditioning is not only a passion of yours on an intellectual level, but also just in terms of who you are and what you like to do as somebody who's very, very competitive with regards to clean and jerk and the snatch. But when I'm talking load management, and I think when people hear that, sometimes they either think it's very, 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 very simple, or it's something that's complex and maybe hard to manage out of the clinic. So for people looking for a little bit more of a practical definition and an easier way of communicating that to the clients or patients that they're working with, how would you describe what exactly load management is?
Absolutely. And that's a phenomenal question. Like, that's something I tried to cover in our recent seminar series as best I could. Like, load management has become this ubiquitous term. I think more people are hearing it over and over again. Like, they're talking about it in the NBA. They're talking about it in soccer. I think football is kind of starting to come around to this idea of, if you have athletes or individuals that have like poor load management strategies, or they're doing too much or doing too little, that they're not getting the performance or the adaptive benefits they're looking for. So I think it's become almost too ubiquitous. So when I talk about load management, whether it's with a patient or an athlete or even a client, I basically use load management and I relate it to stress management. So load, like physical load in terms of lifting, is just one type of stressor. So when I think stressors, I think everything from what is the person doing all the way to how are they recovering? What are their other stressors? What are their psychological stressors? What's their mental state? I like the example of, if we have an individual who comes to you and they've got a lot of stuff going on in their life. They're working 2 jobs, they're not sleeping well, they've got kids. That's someone who has a lot of stress. So they're dealing with a large amount of stress, even though they're not physically loaded. Versus, say you have a young athlete who they sleep really well, they eat really well, they're going to be able to tolerate more physical stress or more load because their adaptive abilities are greater. So I'm sure a lot of people have heard this, but when I talk about stress management, there's a stress bucket concept, which a lot of physical therapists and coaches have become familiar with. It's just this idea that we have this like theoretical bucket, which is kind of our available resources. So every time we add stress to the bucket fills up a little bit more. These stressors can be physical load, which could be your workout, It can be psychological stressors, and it can be kind of outside stressors just day to day. Over time, as you add more and more stressors to the bucket, it starts to fill up with water. So our goal as either a physical therapist or a strength and conditioning coach is to either make their individual's bucket bigger so they can tolerate a greater amount of stress, or in addition to that, give them kind of outlet. So imagine if it has a spout on the bottom, how can you open the spout and kind of drain some of that bucket? So when we're talking about this concept of load management, it's trying to build a bigger bucket over time through physical loading and through progressive training. And from a recovery standpoint, it's trying to help drain that bucket by what's their sleep like? What's their nutrition like? What are their stress management strategies? That could be any number of things depending on the person. So it's kind of looking at this, when we talk about load management, it's really looking at the whole person in terms of what sort of stresses are they facing from a training standpoint and from a day-to-day standpoint.
Mike, I think you did a great job of really detailing that and especially giving some quick, easy take-home analogies. I'm also aware that there's a lot of misconceptions with regards to load management outside of just defining it. What are some of the common misconceptions that you've encountered, and maybe how would you redirect some of those misconceptions?
Yeah, absolutely. I think especially in load management came from periodization or from programming. So the whole premise of load management is that if you progressively increase the amount that someone's lifting, the intensity that they're lifting at over time, that they will be able to tolerate more work, which is very true. But I think it's become like this, almost like a silver bullet, that people think it's like a perfect science. And in reality, there's a lot of unknowns. There are so many variable factors. Every individual is going to respond a little bit differently, even if they have the exact same workout program. So I always use the example of, imagine you're in a high school weight room and you have a team of, say, like 17 or 18-year-old football players. If you give every single one of those individuals the exact same program and they do it to a T, you're going to relatively have a complete multitude of different outcomes from that same program. So it's one way to think of it is you can have the best program in the world, but it's not going to give you a exact outcome. So there's much more of a art to it than just a science. So some people think of it as like a cookie cutter, like we need to give them this amount of reps, this amount of sets. But in reality, it's more so, okay, let's give them something in the beginning. Let's see how they react to it, and then let's adapt it from there. It's just like we would do in the clinic. If somebody comes into us and they're flared up, we're going to adjust our treatment for that day and then move forward from there based on the result that we see. So I think some people give it too much of a credit, kind of like they focus too much on the numbers, like the numerical values of the weight that's being lifted or the reps that are being performed, and they take away a little bit too much from the subjective side and from the person aspect of it.
So I think when you're talking about numbers, the 10% rule say comes to mind. Maybe a little bit easier to manage from a mileage standpoint, or if somebody's very, very good at the volume of the weight that they're lifting. But you bring up subjective. What are some things that people are asking to keep this subjective side in mind, or maybe even to measure that individual's reporting of the stress that they're undergoing?
Yep. And that's something that I think from a rehab standpoint, we ask a lot of these questions without even realizing them. So the one that comes to mind is like your simple pain scales. And there's a lot of opinions about these, but as simple as, hey, from a level of discomfort, 10 being the worst, 0 being none at all, like what was your discomfort during that activity? Or what are you feeling right now? So that might give you a baseline of like, hey, how does this person feel with a given activity? Then you can ask about things like, hey, what's your soreness level? So maybe it's like a 1 to 5. So it's subjective because it's going to vary person to person, but it gives you very valuable information about how that person is feeling, how they're tolerating what you're giving them, and if you potentially need to make some changes. You can do the same thing for, hey, how did you sleep last night? So maybe you don't get hours per sleep, but you just say like, do you feel rested? Do you feel ready? There are tons of other metrics. The one that I use pretty frequently just to get a quick gauge on people is I use this kind of idea of a red light, a yellow light, or a green light. And that's quite simply that if somebody's a red light, it's like they're in pain, they're flared up, it doesn't feel good. If they're a yellow light, it's more so like it's a little achy, like it's a little dull, but I feel like I can work through it. And green light is I'm good to go, like I feel awesome. So you can use those sorts of subjective metrics on different scales and get a really good, useful, immediate feedback that then can be applied to either your training program, your rehab program, or or just kind of your day-to-day movements?
So one of the things that I think of when I hear load management, and it ties in a little bit to some of the subjective reporting that you just discussed, probably would be seen a little bit more in the NBA, at least in terms of this term becoming more prominent. But we just had a big lull in physical activity across professional leagues, across high school leagues. What are some conversations that you really recommend people having with patients or clients right now, as people potentially have an increase in, increase in physical activity, and maybe have some kind of itis or acute response to their workload?
Yep. And I think this is going to become very prevalent in the next couple of weeks and months, like you said. I think a lot of kids are starting to go back to sports when they've gone for a couple months of not doing a whole lot. Even professional athletes who haven't been playing their sport, they can be in the best condition ever and still be very strong. But just because they haven't been doing the demands of their actual sport, they may come across some of these like kind of what you described, like the itises, the overuse injuries. What I would tell pretty much any athlete who's getting back to a high level of training is to take things a little bit slower than they had been before. So if you think about how much work they were doing in the previous season or the previous preseason, they're not going to be at a level where they can tolerate that same amount. So say in the past they had 5 practices a week. If they start in with 5 practices a week for say 2 hours, they're very likely not going to be able to tolerate that load for an extended period of time. So if I'm talking to a parent or if I'm talking to a coach, I might say like, hey, let's spend some time early on doing some, like, we can keep the practice the same length, but let's spend more time doing some like lower level drill work, or let's increase the rest periods. So if we think about like this, the macro of how much overall work are they doing during a practice, we keep it the same, but either we increase the rest periods or we cut down the intensity of what they're doing. And for, say you're talking with a coach, you say, hey, maybe instead of doing, like, let's just use an arbitrary number. Say they run 10 miles a week. Maybe we cut that down initially and we just do 5. And then the next week, hey, let's bump it up like 10 or 15%, like you said. And then the following week, hey, let's do 10 or 15% more. So that way you give them some guardrails where they understand that there might be some of these aches and pains from getting back into this activity we haven't been doing, but here are some things we want to minimize. It's like, hey, if this comes up and this starts bothering you, maybe let's cut it back just a little bit, or let's take 1 day out a week, but still do as much as we can. So I think it becomes very much like give your athletes guardrails where you say, like, if you're feeling a little bit of this, we're probably okay. But if it gets to the point where you're not recovering between workouts, or you feel like your performance is impaired, or you're not sleeping well, there are probably some things that we need to adjust within that framework.
I think that's going to be very, very challenging, just given the timelines in place surrounding competition still, the fact that we've never had this big gap, especially for high school, you think college professional athletes, where they're going through a block of time where they're never really having as much formal training as they're used to. So I'm definitely curious to see how things play out. But if we take this away from the athletic setting and then we bring it back more to the rehab side of the house, when we take somebody who just had surgery, what are some early considerations or even conversations that you're having with that individual surrounding load management?
Yeah, absolutely. This is something that we talk about every single day, even if we don't call it load management. I mean, I think the stereotypical example is, say you have somebody that just had a knee surgery or they had an ACL repair. When they're coming to you initially, the biggest consideration is you need to find ways to protect the integrity of that joint, or the integrity of that surgery, or even just to allow the natural healing process to take place. So when we talk about load management from a rehab perspective, early on, we're really thinking about how can we restore the tissue and the tissue tolerance to as normal of a degree as possible. So when you think about load management from a strength side, we just think about we need to add more. From a rehab side, we need to start on the side of conservation and be very, very conservative, and then progressively add things as we can, or as are tolerated over this longer period of time. So the biggest thing to consider early on is, like, what phase of healing are they in? If they're in a very acute phase, you are not going to be able to physically load the tissue very much, just because of those the inflammatory cascade, the pain threshold is going to be much lower, and they're just not going to be very willing to put a whole lot of force through that joint, just because of all the affected nature of it. So early on, our load management might be, hey, let's do as much with other joints and with other areas as we can, just to maintain some of your other fitness qualities. So say in the event of like an ACL repair, maybe they're doing some upper extremity bike workouts. Maybe they're doing some upper extremity strength and power workouts. But in the meantime, we're taking care of the affected side, and we're just building up tolerance in other areas. As they start to get a little bit better there, now we start to progressively load the joint. So say they get out of the acute phase, they're going more towards the subacute phase. Now we need to actually start adding physical tolerance and tissue changes, which are going to take a couple weeks and a couple months. So we have to be kind of cognizant of how long these timescales are, because early on, the inflammatory phase might only be a couple weeks. But from like a quote unquote strength phase, it might take us weeks or months to build up desirable tissue qualities that are necessary before this person gets back to their previous level of activity. So the really cool thing is we can use long-term load management strategies within rehab, but just have the emphasis, the understanding of like, where is this person in this process? Like, are they physically prepared to tolerate what we're asking them to do? So an example would be, okay, if they have sufficient isometric strength, now we start adding in a little bit more eccentric and concentric. But if they don't have a sufficient foundation in that, we definitely should not be doing any sort of power or plyometric activities. So it's really just like, you talk about checklists all the time. So think of it like from the top of the checklist, we think about, okay, is their tissue sensitivity good enough to tolerate loading? Perfect. Okay, do they have adequate strength? Perfect. Do they have adequate power? Perfect. All right, now let's start adding in some plyometric or some reactive training. Perfect. All right, now let's add in maybe some more specific training, whether it's sport specific or the activity they want to get back into. So that's kind of how my mind uses these. It's the same talk of like load management or periodization, but now we're using it within the framework of rehabilitation. And we have to understand those distinct phases and how that influences our rehab process in order to kind of take the next step and then the next step.
I'm going to dive into a little bit of what you talked about with regards to keeping in mind mechanical stress, especially early on in a joint compromised individual. But as they go throughout their process, recognizing that the metabolic stress that they could potentially achieve early on is essential to long-term adaptations and long-term success in that program. Can you talk a little bit about that chronic workload and especially the buildup of, let's just say, load over a long period of time and a longer rehabilitation program?
Absolutely. And that's vital. Like that goes what we talked about earlier about, so say you have an athlete who doesn't do anything for 4 or 5 months, they're going to be very unprepared because they have not, from a structural standpoint and from a metabolic standpoint, they have not been loaded sufficiently. So their level of relative preparation is going to be much lower. So one way to think about it is you have an athlete who's played, say they're like a 3-sport athlete. So they're playing something year round. Their general level of preparation is going to be much higher because what they've done is they're constantly doing something that's relatively intense. They're constantly loading tissues. They're constantly going through a full range of motion. If you have someone, say in the case of ACL or some sort of major injury, they are going to have a relative degree of underloading for those specific tissues. So early on in the process, if we can get some sort of metabolic stimulus or adaptation or stress, that is going to help prepare us for the future. So it's kind of like the groundwork of take the adaptation that's going to take the longest to achieve and start it as soon as possible. So in the case of someone who, say they haven't been able to do anything because they've been stuck in a boot for a while, maybe you start them with some aerobic workouts. Maybe you put them on an upper extremity bike, or maybe you have them do some circuit workouts where they're kind of building up some physical capacity. So you're stressing the cardiovascular system, you're stressing their mitochondria, you're stressing their peripheral adaptations. And then from there, as they start to build their tolerance, now you start adding in a little bit more power-based stuff. So you can look at this from almost an energy system standpoint, where early on, we're getting these broad scale, systemic changes to the entire body. And as they start to build those up, their energy or their energy utilization is going to improve. So their tolerance to loading over time is going to improve. So it's like this foundation of, imagine a pyramid. At the very bottom of the pyramid, we're going to have kind of like our cardiovascular or our energy system foundation. And then as you build up, we're going to add in kind of our strength foundation on top of that. And then you go up a little bit higher and you have a little bit more power foundation. That's going to be like, what is our speed of movement under load? And then last but not least, in the very end of the process, that's when we start looking at more specific, like sport-specific movements or technical movements. if you don't have the groundwork of the metabolic and the structural resilience, it's not going to be as feasible, or the peak of the pyramid isn't going to be as high if you haven't laid that groundwork. It's kind of like putting in the plumbing for your house before you've even laid the foundation. You've got to start from the ground, and you've got to build up over time.
Mike, I think you do a tremendous job of this, and I think you really, really did our listeners today a really tremendous service. If you had any just parting thoughts, especially for the PT students or the new clinicians, what would they be?
I think one thing is we hear this all the time, but it's practice what you preach. I think if you have somebody write you a physical program, like a training program, and you go through it, I think you have to experience say you're giving somebody a workout program. If you don't know what they're experiencing and what they're feeling, I think that's something you're kind of doing a disservice to your client or your athlete. I think we really need to practice what we preach and understand how programming influences all the decisions that we make. So from a physical therapy student standpoint, I know a lot of my classmates, and even myself until recently, didn't have a whole lot of experience with writing long-term programs. But I think it's really beneficial that if you find somebody who has that background, sit down with them and pick their brain. Ask them hey, if you have 6 months with somebody, how can you make them the best they can be in that period of time? Because I think with physical therapy and kind of the nature of our medical system, we are very limited in terms of the duration of time we work with people. So it's very, very helpful if we have that kind of macro lens of if we're given the time, what sort of changes can we work with? Say we're given a 2 to 3 week period of time. We have to expedite that time frame, but we can still touch on all of those different variables. So that would be one of my biggest recommendations for students, new grads, even just people that want to learn more about how to apply these principles of load management, is take yourself through a program, ask more questions, hook up with a strength and conditioning coach, and kind of have them take you through their thought processes of how they create these desirable performance adaptations.
It was great, Mike. I really appreciate all of your time today. And for people who are looking to connect with you further and maybe ask more questions about load management, where would it be best for them to reach out?
Yeah, the best is probably reach out to me on Instagram. My handle is Mike_R_Oly, OLY, or just look us up on the Rehab to Perform page. I'm throughout that. We also have R2P Academy. We all post there pretty frequently, so you should be able to connect with any of us via those pathways.
Awesome, Mike. Thanks for your time today. I greatly appreciate it.
Thank you very much.